Thank you for the opportunity to be here today. And as Mike said, we're going to be associating ourselves with remarks of previous speakers a lot today. And I'd like to just acknowledge Tony West left pretty quickly, but he said some exciting things. He said some exciting things about opportunities for pilot projects and demonstrations of collaboration, innovation to create the connections between the criminal justice system and the healthcare system. I think that's pretty important. I was very excited to hear it. He acknowledged, by quoting Mr. Machiavelli, that change is pretty hard, and change is pretty hard particularly when you're dealing with two systems that are very, very different, very disconnected up until this point. So I want to associate myself with that remark as well. I've worked in the Medicaid space and have been working in the Medicaid space for a long time, and when the ACA came around, I was very excited, obviously, about the opportunity to increase coverage. But I think two of the areas that have the biggest opportunities in the ACA, the most exciting opportunities from my perspective in working particularly on complex population issues, are the dual eligibles and the opportunity to integrate care for the dual eligibles that was created under the ACA, and this not necessarily explicit, but certainly huge opportunity to engage a population of people who have been left out completely, that is the jail-involved population. So I know that Tony West said that, others have said it. I want to underscore that that is the hugest opportunity, or one of the hugest opportunities from the ACA. So we at the Center for Healthcare Strategies, we are a nonprofit, national nonprofit organization that works primarily on implementation issues. That's another thing I want to associate myself with. Steve said this, we're now at the implementation phase. We've talked about it, we've convinced a few people, we've done the selling of the idea. Now we have to make it work, and that's not easy, but that's where we like to be, because as somebody once said to us, the implementation is where policy falls down, and that's what we're trying to achieve here. So we work with states all across the country, primarily Medicaid stakeholders, Medicaid agencies. I see some colleagues from Medicaid health plans. And we're working in states across the spectrum, red, blue, purple, whatever color state you might be. And in fact, one of the big programs that has enabled us to do that is funded by the Robert Wood Johnson Foundation, called the Medicaid Leadership Institute, where we work with Medicaid directors in states all across the country, including Elena in the past, but also this year we have Florida and Kentucky and Kansas, Wisconsin, Minnesota, and Vermont, speaking of a range. So we're working with all of these states on implementation issues, and we care as an organization a lot about access and coverage and access to services, but also, as I mentioned already, complex populations. So in talking to Medicaid directors, about this opportunity, first of all, we have to take into account the fact that Medicaid directors and Medicaid agencies across the country have a few things to do these days. Thank you for the little chuckle, I appreciate that. You must be from Medicaid. But there are a lot of things on the plates of Medicaid directors, and we can talk to them about this and the importance of this, but we also have to recognize that they're dealing with the duals, they're dealing with coverage, they're dealing with marketplace expansion, ongoing fiscal, et cetera. They're dealing with many, many opportunities. This is a big one. What we have to do is try and convince them and get them to see the light that this is a win-win-win for a lot of people in their world, but also in the criminal justice world. So the arguments that have been laid out already, many people, many of the jail involved are in the expansion population, many will have inadequate treatment before they get in, and when they leave on the mental health and substance abuse service side in particular. We can make those, and then we can say to them, you know, getting them into coverage and getting them into care is not only going to help them and improve their lives and their quality of life, but it's also going to potentially save resources down the road for your agencies in terms of hospitalizations and ER utilization, but also on the criminal justice side and the counties, et cetera. So there is, in terms of reducing recidivism. So there are tremendous opportunities, and we can convince them, and fortunately we have one example here in Elena of someone who has been convinced that this is a big opportunity. So there are two parts of what Medicaid agencies, and I'm breaking it down and oversimplifying, that they really need to think about, Medicaid agencies and their partners. One is the enrollment issue, and Marcia has spoken to that, and others have spoken to that to a degree already. The determination of eligibility, enrollment, suspension versus termination, all of those issues. The other is connecting them to services once they have this card. And the card is a nice thing to have, but you need to help them, in many instances, connect to their managed care organizations that are going to be responsible for them. Managed care organizations have to get the information they need to know that they have these people enrolled in their plans, and then they need to connect them to the services that they need, whether it's a primary care physician or a substance abuse or mental health agency. And that is, I think, the next big challenge ahead in terms of implementation. So a couple of issues there that I think are really worth paying attention to. One, the mental health and substance abuse is, first of all, in Medicaid, much of that is carved out of the physical health program area. So you have two sets of agencies. It could be behavioral health plans and physical health plans, could be fee-for-service behavioral health, substance abuse. So you have fragmentation within the Medicaid system already, and you don't have, until more recently, with the attention to mental health parity and the essential benefits or alternative benefits plans that have been described already, you don't have as much attention in traditional Medicaid to building up the necessary mental health and substance abuse services. So there's a job ahead in terms of building the capacity on the mental health and substance abuse side, and in terms of enabling those providers to connect with the healthcare system in ways that they haven't connected with the healthcare system in the past. Many of them haven't billed Medicaid. They may not have good billing systems. As someone mentioned earlier, IT and electronic medical records. They're not likely to have those kinds of things. And the data connectivity on the service side is another very important issue that needs to be dealt with. So going forward, just summarizing, eligibility determination in terms of the opportunities for Medicaid stakeholders, that is to say states, plans, providers, and the criminal justice system, whether at the county level or in some few instances at the state level. The opportunities are on the eligibility determination front, the enrollment into coverage, and then the enrollment into managed care organizations or into what their form of coverage is going to be. Then the selection of providers and the connection to those providers, and even scheduling, and I know Elena may speak to this, scheduling their first visit as they're leaving the door or before they leave the door so that they have a place to go and know that they have a place to go right away. And then there's a whole raft of issues around data sharing that need to be dealt with going forward as well. So, because a lot of this is about having people know what people are experiencing or what drugs they're using or what emergency room visits they're doing, those kinds of connections are all big opportunities for a lot of work ahead. But as I said, at the beginning, I think that this is one of the most exciting areas that has been created by the Affordable Care Act. Again, there are a lot of things that didn't go right, and there are a lot of things that have gone very well, and we want this to be one of the things that goes very well going forward, and that's the challenge I think that Steve put in front of us at the beginning of this session. So I look forward to the information exchange, but first I look forward to hearing from Elena.